Hi guys, William Quang here from the Adelaide Heel Pain Clinic and SA Running Injury Clinic. Just a nice sunny day today. Now, I'm just going to give you a quick little spiel, a bit of another rant. I don't mean to rant too much, but we've had 2 in the last 2 weeks. But we've had 3 recent cases where people, other practitioners have used Shockwave in inappropriate times. So I'm just going to do this, and I also know that there's actually quite a lot of physios and podiatrists that actually and chiropractors who actually watch us. So just thought I'd help them out and educate them, since we do use Shockwave the second most in the country according to the manufacturers. So the first thing I would like to talk about is the appropriate age. So we had a child come in about 3 weeks ago, and they were 12 years old with a condition called severs. Now what was it, physio? Yeah, no, it was a podiatrist. A podiatrist actually used Shockwave on it. So the literature says not to use Shockwave on children under 16, particularly at that growth plate. So that's quite dangerous. Okay. The second one that we got was probably about 2 months ago. We had a nice English girl who came in from a physio who actually had the Shockwave the day after she had a cortisone injection. Okay, that's a big no-no. Minimum time is usually 6 weeks. We prefer to go to about 8 weeks, but yeah, the literature says really be careful there, because there's potential for rupture or damage of the ligament. Third one I saw on Monday. We actually had a knee pain patient, and it was diagnosed as patella tendonitis. So after doing a fair bit of, there's the Shockwave there if you can hear it, after doing a fair bit of analysis and going through their history and examination, we found that this physio had misdiagnosed as patella tendonitis. It was actually patellofemoral pain or mistrack of the kneecap. So Shockwave Therapy hadn't worked for this guy, and it shouldn't have, because it wasn't actually a tendon issue. So Shockwave wouldn't have worked in that circumstance. Okay, so they're the three things that definitely Shockwave shouldn't be used for. 1, shouldn't be used for kids under the age of 16. 2, never use it until 6 weeks post cortisone injection. Thirdly, make sure they diagnose it right, because if it's not used in the right area, it's not going to do anything and can have potential harm. All right, so that's my chat for today. Now, as you can sort of see, the weather's really, really nice out there. So I thought on Tuesday next week, I'm going to actually talk about those outdoor gyms. I don't know if you've seen them. They've got all the weights and all that on those sections of all those parks in Adelaide, and they're all scattered through. So I'm going to do a Facebook Live at one of those locations, and also if you guys want the checklist, you can we can give you a little list of where the closest ones to you are. All right, see you later, folks. We'll see you next Tuesday. Bye.